Hi, good evening all. My name is Dr. Anoop Agrawal. I'm an interventional cardiologist at Care Hospitals, Banjara Hills, Hyderabad. On this World Heart Day, the objective of our talk today is to understand about heart attack, its causes, and preventive measures that can be taken to avoid a heart attack. Now, India, similar to other economies worldwide, is witnessing an upsurge in heart disease. And patients typically are presenting at a younger age, and they tend to have more heart disease than what they were having before. So in today's discussion, we are going to understand what is heart attack and what are the risk factors for it and what we can do to minimize those risk factors. Now remember, heart is the most essential organ of human body. It is a positive displacement pump, as in, with every heartbeat, the heart muscle squeezes the oxygen-rich blood out of the heart cavity to rest of the body. Now, this oxygen-rich blood is distributed to entire body, entire organ system, and it's vital for the body system to work. If our organs don't get this oxygen-rich blood, they don't work. They essentially die over the period of time. Now remember, heart also is an organ, which means heart also needs this oxygen-rich blood. And to do so, of the blood that heart pumps, there are small tubes which supply this oxygen-rich blood to the heart muscles themselves. These small tubes are called coronary arteries or blood vessels that supply blood to the heart muscle. If there is any blockage or obstruction to these blood vessels, then the heart muscle itself will not get the blood supply or will not get the food and nutrient and oxygen that it needs. If the blockages become significant or if the blockages become critical, then that part of the heart muscle will not get the blood supply and it will die. That is what is called a heart attack. And if a large portion of heart muscle is damaged, then it can cause heart failure. And sometimes heart attack and heart failure can lead to a person's demise or death as well. Now, the key reasons why blockages form in these blood vessels are diabetes, increased blood pressure, and cholesterol deposition inside those blood vessels. Remember, persistent high blood sugar, high blood pressure, and increased cholesterol, they essentially damages the heart artery. They make the arteries stiff, and they also damage the inner lining of these coronary arteries. Now, the inner linings, which are now damaged and the vessel stiff, it becomes a perfect place for these cholesterol to deposit and form blockages. Over the period of time, these blockages, they just keep growing. And at some point, the blockages become critical, where it starts causing symptoms. And if the criticality is significant, then it can lead to significant impairment or impediment in blood flow, and that can lead to heart attack. Now, these symptoms that the patients often present, they could be chest discomfort, they could be chest pain, they could be just vague, dull sensation, heaviness on the chest. All these discomfort, there are various discomfort spectrum, which is presented by various patients. Remember, each one of us are different. So the way heart attack or angina presents in each one of us is different. And that is something we have to understand. In fact, many of the times, patients may not even have the classic chest discomfort symptoms that one may, that one is used to seeing. Sometimes patients may present with epigastric burning that looks like or feels like somebody is having an acidity. Sometimes they may have dizziness, giddiness, jaw pain, throat pain. A lot of these symptoms often mimic that of heart attack. And it becomes very difficult for a doctor to evaluate each of those symptoms and make sure that they don't have, that they're not having any heart attack or heart damage. Now, remember one more thing, that sometimes heart attack can present with what we call as a sudden cardiac death or a cardiac arrest, where the heart just stops working. And when the heart becomes too weak, often the presenting complaint is shortness of breath. That is, heart is not able to keep up with the body's demand, and that lead to exertional breathing difficulty or shortness of breath. Now, while the risk factors are what we call as diabetes, high blood pressure, cholesterol, aging, ethnicity, and whatnot, some of these risk factors can be mitigated by making positive changes in our lifestyle. And I'm going to describe you some of the common positive changes that you can make in your life to mitigate some of these risks. The most important being eating a heart healthy diet. And what I mean by that is eating more fruits, vegetables in your diet, whole grain, dairy, poultry, fish, lean meat, food which are non-fried, which are typically roasted or cooked in low fat. These food items, they are far more useful to your body, and they don't impose as much of risk as compared to some of the other food items that I'm going to describe. Simple carbohydrate like rice, potato, sugar, those kind of things, they are far more detrimental to your heart as compared to others that I mentioned. Sugary beverages are equally very problematic. Vegetables and fruits, not only they provide necessary nutrient, they also add fullness to your diet, reducing the calorie intake, helping you to lose weight, helping you to reduce blood pressure, as well as leading a healthy lifestyle. They do add necessary fiber in the diet, which also help reducing cholesterol. They also have various other substances which help you prevent cardiovascular disease. Some of the food items are very high in saturated fat. Saturated fat is the kind of fat which increases cholesterol level in your body. It increases the risk of blockages in your blood vessels. Some of those items are processed cheese, red meat, tropical oils like coconut oil that is exceedingly being used, or highly processed food items. A lot of these items like vanaspati oil is used in this processed food, and that also can lead to increased cholesterol level in your body and leading to blockages into your heart. Unsaturated fat, on the other hand, is heart healthy. So these are the fat items which don't really cause that much of blockages or that much of cholesterol change in your body. They may actually prove to be beneficial to your coronary artery disease. Food items which contain high amount of unsaturated fat are nuts, like commonly that you eat, like almonds. These have high levels of unsaturated fat. Plant seeds like sunflower seeds and whatnot, they also have got high unsaturated fat. Chia seeds these days are very commonly consumed. Fish, olive oil, etc. Some of these items, they have got high content of unsaturated fat, and they can be considered heart healthy. Another important dietary information is salt intake. So we all know that patients who have got high blood pressure or hypertension, they should reduce their salt intake. The truth is, patients who don't have hypertension, they also should reduce their salt intake. And we should try to reduce our salt to about maybe 2.5 to 3 grams of sodium per day. That would come out to be about 5 grams or 6 grams of table salt per day. People who have hypertension, their salt intake should be half to what I just described. So we should prepare food with minimal amount of salt, and also start reading food labels, because many of the times the prepared food that we take, like chips or whatnot, they have got very high salt content. In fact, those food items which also says low sodium, even they have got very high salt intake. So we should learn how to read the food labels and consume less salt as needed. Another aspect other than diet is exercise regimen and weight. Remember, regular physical activity not only makes you healthier, physically fit and stronger, it is heart healthy. Why? Because your heart is constantly in a proper shape where it continues to work, and it recruits what we call as collaterals or capillaries, where the blood flow inside the heart improves because of exercise. So exercise, other than burning calories, also keeps you fit. Remember one thing, exercise is good to maintain health, but exercise is not a good way to lose weight. So if your intention is to lose weight, then the target should be calorie count or calorie reduction. There is a common saying that you lose weight in kitchen and you remain fit in the gym. So you continue to do exercise to stay healthy and stay fit. Aerobic exercises are very helpful because they maintain a cardiac status and they maintain cardiac fitness. Some of those aerobic exercises could be regular walking or jogging, biking, those kind of things. People who have got joint problems, they can do exercises which do not require that much of knee or hip joint movement. Like for example, being on an elliptical or upper arm exercises. Some of the patients, some of the people, they may tolerate swimming better than running or jogging. So that is typically for the exercise. There are few cheat sheet for you to know how much to exercise. So a moderate intensity exercise. And moderate intensity exercise, how do you know you are doing moderate intensity? A common way of knowing this is if you can sing while you are doing exercise, that's a light intensity exercise. If you cannot sing, but you can talk, that's a moderate intensity exercise. And if you cannot even talk, that's a high intensity exercise. So that's a way for you to know whether you're doing a moderate intensity or high intensity exercise. And you should aim for 150 minutes of moderate intensity exercise per week, or 75 minutes of high intensity exercise per week. That's the minimum amount of exercise that you should use. And if you have pedometer, then you should aim for about 10,000 steps per day. These are some of the cheat sheet that you can use to understand how much exercise you should do daily to stay fit. The third point is smoking and alcohol. Now remember, a little bit of alcohol in your body may not cause much damage, but any amount of smoking causes a lot of damage to the heart. So to folks who smoke, my suggestion is that please stop smoking, because there is nothing good that comes out of it. It is the single biggest killer in the world. And this is something that we absolutely should avoid. As far as alcohol is concerned, taking a little bit of alcohol is acceptable. I wouldn't say recommended, but it is acceptable. Remember, with alcohol, there is one problem. It adds to your weight because these are empty calories. Alcohol, when is consumed, it adds to the caloric burden and it increases weight gain, or it causes weight gain. So you should limit your alcohol intake. And a cheat sheet for that is, for men, it should be less than 50-60 ml of hard liquor daily. And for women, it should be less than 30 ml of hard liquor daily. And you can do a weekly calculation to that, but you should limit your alcohol intake within that realm. Now remember, these numbers are there in folks who otherwise have normal body organ function. People who have got heart disease or diabetes or high blood pressure or kidney disease or liver disease, they absolutely should not consume alcohol at all. Last but not the least, we should talk about stress, because while stress does not cause disease, it certainly makes the existing problem worse. And we know we all have stress in our life. So we should try to learn how to manage our personal as well as professional stress so that we can mitigate some of the stress related problem in our body. Remember, mind over matter. Our mind controls how our body functions. So if your mind is healthy, our heart is going to be healthy. If we are too much stressed out, then achieving a good cardiac health may be a little bit more difficult. So overall, I want to say that it is possible to maintain a heart healthy diet, a heart healthy lifestyle, and reduce the risk of heart attack or heart disease or heart failure in the future. Pay attention to your diet, pay attention to how much exercise you do. Quit smoking for sure, limit your alcohol intake, and manage stress. By taking these actions, you will be able to reduce your cholesterol, you'll be able to control your blood pressure and your diabetes, and you should be able to lead a much healthier lifestyle than what would otherwise be. With this, I'm going to sign off. Thank you so much for your kind attention, and have a good World Heart Day. Remember, the current tagline is use heart to treat heart disease. So use your heart to connect to people who have got heart problem and do your best to treat heart disease. Thank you all. Have a good day and good rest of the year. My name is Anoop Agrawal. I'm a cardiologist at Care Hospital. Thank you.